Hello, everyone. My name is Laura Turner. I'm a journalist at Channel 9. Do we call me journalist? Some people just call me a reporter. Maybe I'm a used car salesman. Not today. You are all treated to a first-hand experience. I just picked up my first pair of glasses in 30 years on the way here because I'm now old. And I've never worn them, but I'm going to try them out in front of you. So if I pass out or faint or look weird and dizzy, then I promise you it's just the glasses, nothing else. Here we are, the inaugural, whoa, okay, there we go. Can I? I'm not sure that I can. As I said, I'm Laura Turner. I'm a senior journalist at Channel 9 and I have lived experience with addiction, mental illness and sadly fatal overdose. Welcome everyone. This is such an important discussion today. As everyone in this room knows, we don't need to convince ourselves of that. But hopefully we can all learn something today, something we didn't know or something that we didn't know of someone else. I want to start by beginning by acknowledging the Wurundjeri people of the Kulin Nation, the traditional owners of the land on which we meet today, and pay respect to elders past, present and emerging. We acknowledge that this land was never ceded. I also want to acknowledge lived and living experience as well. I recognise people with lived and living experience of trauma, neurodiversity, mental health challenges, psychological distress, suicide, substance use or addiction, and their families, carers, supporters, those experiencing bereavement, advocates and allies, of course. A little explanation of my story. The issues of drug law reform, addiction, stigma, mental illness as well, are really close to my heart. In 2017, my older sister Sky died of a fatal heroin overdose. She was in the back of a van on Elizabeth Street in Melbourne CBD. It was a very, very hot Labor Day long weekend. The person she was with knew she was overdosing and didn't do anything to help her, which has become really hard for me to let go of. And we don't actually even know which date she died, which is another thing that's been really hard to cope with, not having a concrete anniversary. We know her body was driven around in that van for perhaps 24 hours. So some real pain there, and that doesn't make my story any more special than anyone else's because I know there's real pain with every overdose death. Sky's death really rocked me though. She was my only sibling. She was my older sibling. And it left me searching for answers that, even though I knew there perhaps wasn't going to be a happy ending to Sky's story, I don't think I really ever fathomed what questions there were after that point and what I needed answers to. I, of course, live with guilt. Why didn't I try harder for her? What could I have done to save her? Should have I gone easier on her? Should I have gone harder on her? They're all questions you ask yourself. And some of the last words she said to my mother is that she saw herself as a piece of shit and that she wanted to die. It was a couple of days after that she did. And I think those comments from her were a direct result of shame and stigma in the community. She really felt that. She was very aware of other people's opinions and her appearance in society, and she really felt shame and the stigma of mental health and drug addiction. And I think we all have a role to play in that. I certainly know I do as a sibling who didn't understand for a long time and thought, why can't you just stop? It's black and white. I remember yelling at her, it's pretty simple, just stop and your life will stop falling apart. We all know that that's, we wish that was true, but it's not. So I think, the judgments that sometimes we accidentally verbalise in public, the offhand remarks we make to our friends, we need to be aware of because it does sink in. And then, of course, what I'm referring to is, oh, they're just a junkie. I know no one in this room would say that, but we hear it and it hurts. The lived experience... That's all right. It's all right. Might be someone important. You can answer it if you want. The lived experience of someone close to another person suffering from addiction is torturous. It is torture. The struggle with their mental illness, with being pushed away, with being called upon to help but not knowing, should I help? The many times you don't know where they are, and then they'll turn up in a hospital somewhere, or in our case, dead. The news of their death is also not made any easier by the fact that you might have thought that that's what might happen around the corner. It still, you know, rocks you to your core. And even if you feared it for years, nothing can prepare you for that moment. Sky suffered serious mental health issues for years, and now I look back, I think it was really evident when we didn't realise it was. Even in her teenage years, I think there was a lot of evidence. What the hell are we dealing with here? She had depressive bipolar disorder, borderline personality disorder, and was living with some really, really serious trauma that was inflicted on her as a little girl and again later in life. So like so many people I've met since she passed away, I'd love to think that as a society we're at a point where we can quash the judgment and the alienation of those who suffer from addiction. And that we are closer, let's hope we're closer at the polling booths where Australians can see past that hysteria of this so-called war on drugs that we will see on the front of the paper with the elections that are coming up, and vote more in line with facts and research rather than those unfounded fears and outdated opinion that creeps through and into lounge rooms where it is not welcome. And that's why we're here now, of course. We have Victorian candidates from across the political spectrum with us today to present their vision for the new National Drug Strategy, which will be implemented during the next parliamentary term. Each candidate will deliver a 5-minute address outlining their vision for the strategy, followed by a panel discussion where they'll respond to questions from attendees. Those questions, though, will be at the end, so we're going to go through every address first, and then after that we'll take questions from the room and also online as well. So we're going to pivot between the two. Of course, welcoming to the discussion is Jordan Ditloff, Fiona Patten, Ged Kearney and Tara Burnett, almost all of which are in this room. Welcome, guys. Little clap for those who are sharing their time with us today. Thank you for being with us. We're going to hear that 5-minute pitch from Ged Kearney first, who will appear via video this afternoon. So let's turn our attention to that.
Good afternoon. I'm Ged Kearney and I'm the Albanese Labor Government's Assistant Minister for Health and Aged Care, as well as the member for Cooper in Melbourne's wonderful inner north. Can I begin by acknowledging the traditional owners of the land on which I am recording this, the Wurundjeri people of the Kulin Nation, and I pay my respects to elders past and present and extend that respect to any First Nations people joining us today. Thank you to the Victorian Alcohol and Drug Association for inviting me to speak. I'm really sorry I'm unable to join you in person. As the peak body representing publicly funded alcohol and other drug services here in Victoria, you play a crucial role in preventing and reducing AOD-related harms, whether it's engaging on policy development, advocating for systemic change, or providing leadership on priority issues. You form a key role in Australia's AOD sector. Both VAADA and your 50-member organisations, many of whom are here today, are doing life and society-changing work. Can I please extend my deep thanks and gratitude to all of the staff on the front line. Your work may not be glamorous, it certainly doesn't get the thanks it deserves, but know that you are so needed and valued. So thank you. This parliamentary term has seen great advancements in the alcohol and other drugs space, from world-leading legislation to funding and support. Since coming to government, the Albanese Labor government has committed $880 million through the Drug and Alcohol program to reduce the impact of AOD use on individuals, families and community. This funding has supported the treatment, prevention, research, data and other international activities. We've been proud to support the Australian Alcohol and Other Drugs Council through the Health Peak and Advisory Bodies program, as well as state and territory peaks such as VAADA. We've also made reforms to opioid dependence treatment to support affordable and equitable access to ODT medicines. The $185 million invested into the PBS for ODT medicines has meant that 1.1 million prescriptions have been dispensed, saving patients thousands. Also, the take-home naloxone program has meant that to many people who may experience or witness an opioid overdose or adverse reaction can get access to naloxone, a drug that temporarily reverses the effects of an opioid overdose without the need for a script. Through the THN program, naloxone is available from community pharmacies, hospital pharmacies and other outreach services and AOD treatment services. Over 5,200 sites are now registered to supply, and I know many are using the online site locator tool. It's really helping change lives and it makes things so much easier. Another area I'm proud of are our world-leading laws relating to vaping and e-cigarettes. What was sold to the world by multinational corporations as a way to help people get off cigarettes was having the opposite effect. Up to 1 in 6 high school students and 1 in 4 young Australians were vaping. Shops were popping up on every corner, and while e-cigarettes may not contain tobacco, they contain nicotine and other toxic chemicals. They were also being marketed at children with colourful branding and sweet flavours. It's why Labor introduced world-leading legislation to crack down on vaping, with new laws and regulations to stop the import of non-prescription vapes, increase the minimum quality standards for vapes, including by restricting flavours, colours and other ingredients, require pharmaceutical-like packaging, reduce the allowed nicotine concentrations and volumes, and ban all single-use disposable vapes, and close down the sale of vapes in retail settings. Now, these changes were accompanied by $63 million for a public health information campaign and $30 million in support programs to help Australians quit. It was a hard fight to get up. We faced pushback from industry and in the parliament, but it was Labor who got it done. Already we're seeing these changes take effect, with the rates of vaping across the country declining. This term of government, we've also seen work underway through the House of Representatives Standing Committee on Health, Aged Care and Sports inquiry into the health impacts of AOD in Australia. The findings so far have been insightful. Alcohol and drug-related harms remain a major public health concern, with an alarming trend in emerging synthetic drugs increasing overdose risk. And there are limitations in AOD treatment, with challenges with stigma, workforce shortages and service gaps in rural and remote areas. The Australian Labor Party is supportive of this inquiry continuing into the next term of Parliament. Indeed, the inquiry will help inform our next national drug strategy. Already work has been underway to help develop the strategy, with consultation occurring between July and October in 2024. We've heard that stakeholders are eager to ensure that any strategy is evidence-based, informs policy, and is essential to maintaining a focus on harm minimisation right across the sector. Labor will deliver a strategy that strikes the right balance and supports you as the sector to do the very important work you do every day. Thanks again for having me speak, and have a wonderful afternoon.
There you have it, Ged Kearney. So take notes on what she said, but I guess we can't ask questions of her today, but we can compare what she's just said to those of us who are here. The next lady who we have, who is with us in the room, she is a bit of a hero in my eyes. That is Fiona Patten, who in 2022 thought it was all over, but we can't get rid of her. Welcome.
Thanks, Tara. Sorry, thank you, Laura. Thank you, Tara. Thank you, Jordan. Wow. I'm glad she's not in the room for questions. I suspect so. Thank you, VAADA. Thank you, Chris and David. I know that you've been organising this, and it's never easy to get politicians in a room prior to an election. We want to be kissing babies and, you know, making gaffes out there in the public rather than in a private room such as this. But I do know this is being recorded, so it's not that private. Yes, my name's Fiona Patten. I, as many of you know, and I see many friends in this room, I was a Member of Parliament in Victoria, and alcohol and other drugs was really one of my key objectives while I was there. and it still is, and I haven't lost that passion. I possibly have some relevance deprivation, and that's why I'm here again, but I don't actually think that's... Sorry, Lorna. Welcome back from the country. But no, I did think I was finished, and I thought, I'm on the board at the North Richmond Community Health Centre, which I'm really proud of, and I love, and I'm involved in medicinal cannabis and enabling patients to have better access to it, and I thought that was enough, but towards the end of last year, my arm got twisted, and to be honest, I was in Spain. I may have been investigating their social system for cannabis at the time, so this seemed like a great idea. But anyway, I am actually very proud to be running as a Senate candidate for the Legalised Cannabis Party. And the party, well, the name's on the tin. It really is structured to try and change the laws around cannabis and other elements of cannabis such as hemp, but we're underpinned by a set of values, and those values are social justice, their tolerance and compassion, their evidence and environmental led policies, and equality. And I think I'm not going to be changing the curtains in the lodge, even though I know they need changing. And I'm not going to be making government, but I will be there to nudge government. And I think that's the role that I played for 8 years, and that's the role I hope to continue to play. And I think listening to Ged Kearney, I just want to first start with tobacco harm reduction. For some reason, it is so hard to hear politicians talk about harm reduction when it comes to one of the biggest killers, which is smoking. We know in this room that people smoke for the nicotine, they die from the tar. And so to say that we are not going to allow vaping, when I'm just reading the UK just passed legislation where they are handing vapes out to smokers. It's like a swap and go system. You hand us your cigarettes, we give you a vape. Now, their smoking rates are going down. Ours are plateauing. But the idea that prohibition works, the idea that in 2025 we have a minister from a government saying, just say no, and that prohibition is going to work. In fact, I did an April Fool's joke on Tuesday, which kind of worked, where we sort of said we listened to all of the concerns about legalising cannabis and the concerns about the children. So now that we're looking and we're weighing down the health impacts, we're calling for a ban on alcohol, because we think, obviously, prohibition must work if you think that prohibition is working for cannabis. Now, I know in my time I've been asked to speak about the National Drug Strategy. I have a few comments about it. I think, one, there was a brief bit of consultation done last year. I don't think that is acceptable or nearly enough. I think there should be ongoing consultation in a 5-year strategy, which doesn't happen. We see the occasional annual report brought out, but we do not see any measurements of that strategy. Personally, I would like to see a summit first. Now, we've just seen the recommendations from the New South Wales Summit. Now, they certainly weren't earth-shattering, but the fact that we had people able to be in that room, the fact that we could have those conversations, that governments could hear what people wanted and then decide whether they'd support that or not. But I do think that a national summit would work. I also think fundamentally, and this has come up, I know, amongst people in this room, but the notion of a 3-pillar harm minimisation strategy. Now, we'll talk about the spending on the 3 pillars, which, as we all know, is incredibly unbalanced. But I think what I've seen overseas is adding a 4th pillar. So Europe and most parts of the Americas actually has a 4-pillar strategy. So they separate treatment out. And I think this helps to provide a better voice for treatment in that section, but it also helps us talk about harm reduction when they immediately see treatment as harm reduction. And so any money that they say that they're spending on harm reduction is actually generally just spent, is something that they put aside on treatment. So I think this would really clarify where the money is going. And obviously way too much money is going into supply reduction. We know this. And the way we could change that would be law reform. So I would certainly see that the first part of that strategy would be the decriminalisation of drugs. Now, our Prime Minister will say this is a state issue, and in many ways he's right. However, our federal criminal code makes it a crime to possess or use any illicit drugs. So we have to change the federal crime code to enable states to properly do proper decriminalisation, not a kind of quasi-decriminalisation, proper decriminalisation, and possibly a regulated market for some drugs. But initially, just enabling people to legally possess substances, to not be arrested for using substances, and to spend some of that money into helping people, and as we all know in this room, for helping the small number, the minority of people who are negatively impacted by drug use. We know that the millions of people, millions of Australians who use drugs, for most of them, it doesn't change their lives, it doesn't affect their lives. But for the ones that do, we need to wrap our arms around them, and we need to provide the resources. And I think going to Laura's point as well around stigma, without law reform, this stigma will continue. We cannot change stigma while people are being arrested for using certain substances. It's entirely ridiculous, and I think these are areas and these are levers that federal governments can pull. Finally on tobacco, because I was just so incensed by. I like Ged normally. In fact, no, I like her a lot, but they're so wrong on tobacco harm reduction. I look at the supervised injecting centre. The vast majority of people there, they smoke. Now we're saving their lives, and providing pathways to new lives, to ways to change, to start addressing the trauma and all of the other issues that the clients there are facing. But we don't talk about the thing that's actually going to kill them, which is smoking. And I think this is imperative, and I think it is, when I see government saying just say no again, I feel so desolate, because I just think this is going to make it so hard for us to say, well, what about, in fact, we probably, in the ACT, it's legal to possess heroin, it's illegal to possess nicotine. You can go to jail for having an illicit vape in the ACT, but you won't be arrested for having heroin. This is just, it's so preposterous. But back to the thing, I think from the national strategy, I would like, before we do it, we've got till 26, I would like to see a national summit. So we can hear from everyone about this, because all of us in this room have very clear ideas about how we could work better, how we could treat people who use drugs better, how we could ensure that we reduce the harm of certain drug use in a more efficient and more effective way. So I would like to see a summit. I would like to see us consider 4 pillars in our strategy rather than just the 3 of supply reduction, harm reduction, and demand reduction, because most of those just involve the police. So I think having a 4th pillar also puts a spotlight on the treatment and on the services that we offer, and that we offer, while scraping together the funds to do what we do so well. So I look forward to your questions, and thanks again for having me.
Anyone noticed, but my glasses have failed at the first hurdle. I did not read your bio. So, sorry. Would you like me to introduce you to Fiona Patten? I think we're okay. All right. Tara Burnett is next. Don't stand up yet, Tara, because I have a bio to read, actually. Just Who would have thought? Tara is a public school teacher, unionist and renter who is currently running as the Greens candidate for the seat of Cooper, located in the northern suburbs of Melbourne, and at the May 3 election. She's currently on the board of Transgender Victoria and the State Branch Council of the Australian Education Union, and if elected to federal parliament, will become the first trans person elected to a parliament anywhere in Australia. So welcome. Let's hear your thoughts, Tara.
She on? Oh, yes. Thanks so much, Laura, and thank you all for being here. It's a real privilege to be able to come here, not just to be able to chat about drug and harm reduction policies, but to be able to hear from experts in the field. We in the Greens are very grateful for peak bodies like VAADA because you make our lives very, very easy. I am, as you can probably tell from my bio, not someone with a whole lot of experience or expertise in this space. It's why I'm very grateful to be running as part of a team, but also very grateful to be part of a party that is led by evidence-based policies. And it means that we can have a chat to expert peak bodies and basically by, what they said and adopt that as our strategy, right? Our policy on drug harm reduction comes from the principle of harm reduction first and foremost. We've seen, as you know, has been pointed out, and I'm sure will be pointed out as we continue through the day, that these police-based responses have not only not worked, they've in a lot of ways made the problem worse. We've seen that a lot of this attempting to legislate these problems out of existence by sweeping them under the rug not only puts more money into the hands of organised crime, but creates a stigma that creates a lot of deep personal harm in a lot of people's lives. What we basically want to make the core of our principle and the core of our policy is the idea of making sure that we address these issues in a holistic way and in a way that puts the lives of people above the need for police forces to extend control and for companies to post up profits. I, was kind of amused by the past tense used when referring to vapes. Being, as you mentioned, a public school teacher, I am very familiar with the smell of strawberry kiwi every time I'm on the yard duty next to the girls' toilets. So really, what needs to happen is that these things need to be treated as elements of a broader social, I'm not even going to say issue, a broader social setting, right? None of this stuff comes out of a vacuum. No one picks up drugs because they think that everything is going completely fine. Well, certain drugs will definitely some of us will get into when we're particularly enjoying ourselves. But the kind of issue where it gets to the point of that absolute despair, that doesn't generally come from nothing. It will often come from a mental health issue or come from an issue of social isolation, an issue of disenfranchisement, an issue where someone feels just thoroughly disconnected, right? And we know, because we've all seen it, both evidentiary in terms of the figures, but also anecdotally, because we have people in our lives who have used or have been around people involved with drugs and alcohol, that a lot of that needs to be addressed in a holistic sense if we're going to actually think about where these issues come from. I say this as someone who used to smoke. I say this as someone who very seriously abused alcohol when I was younger, right? Like a fair few people who served in the military, you start off drinking rum along with all of the other diggers, and then when you leave, you start filling the rest of the time with the rum as well. It was not the greatest of places, and just getting told, just stop drinking, as I'm sure everybody here knows, is not a solution to any of that, right? So what we want to see is a national strategy on this. As has been pointed out and will continue to be pointed out, a lot of this is a state level responsibility. However, that kind of misses the point. Much like in education, which is an area that I've spent far more time on policy area of, it's one of those things that due to the way that the Constitution was written and then the way that things have evolved in the following century and a quarter, ends up with a lot of what I like to refer to as constitutional buck passing, where the states can point to federal and say, yeah, well, they're not giving us the money to deal with it, so we can't. And federal can point to the states and say, but it's their responsibility to deal with it, and we're not going to give them the money that they need to deal with it because we don't like the state government there, or we're trying to be able to say that we've got a surplus in 3 years instead of 4, right? It requires that kind of national leadership and national coordination, not only because of issues, not only because of issues surrounding imports, not only because of issues around border towns such as Albury-Wodonga, but because if we don't have leadership on this, we're going to continue to see policy that drifts, policy that doesn't have a clear focus, and policy that misses the mark and lets too many innocent people fall through the cracks. Thank you.
All right, lastly, this afternoon, we have Jordan Ditloff. You've got a very interesting bio here, Jordan. When addiction and a failed small business led to a 27-month prison term, Jordan used rock bottom as the foundation for a new life. Since then, he's completed a business degree, managed busy bakery cafes, and graduated at the top of Deakin Law School, all while consistently repaying victims of his offending. Now, as the lead Senate candidate for the Libertarians, Jordan knows the cost of kicking hard decisions down the road and brings his unique life experiences to defending civil liberties and fighting for lower taxes. Welcome, Jordan.
Thank you, Laura. And as you can probably tell from now having read that bio, I was particularly mortified when my phone went off in the middle of your discussion of your life experience. And it was very, very difficult for me to listen to because I've been on both sides of that equation. I've regrettably been involved in trafficking of contraband and drug trafficking, and being someone who struggled with addiction myself. So you could say that I've sort of moved through all three of the pillars, you know, demand reduction, supply reduction, and harm reduction. All three of those are not abstract concepts to me. Look, I'll endorse and adopt Fiona's comments on vaping and Tara's. I gladly accepted the invite to this forum because Fiona and we keep meeting and having arguments in different Senate forums and stuff, and I knew that this one we wouldn't have very many. So to save time, and I will try to actually keep to 5 minutes instead of a politician's 5 minutes, I'm going to talk about something that nobody so far has talked about, and it's the elephant in the room now that needs to be considered in the next 10-year strategy for the National Drug Strategy, and that is illicit tobacco, black market tobacco. Ged Kearney didn't mention it. She mentioned everything except that. I thought she was going to go to it when she was talking about vaping rates. We can no longer ignore the fact that the effect of government policy with respect to tobacco excise, combined with the prohibition of one of the main smoking alternatives, has resulted in a thriving black market. The mid-year financial outcome for the budget listed a $5 billion shortfall of a predicted $14 billion in tobacco excise. The budget just announced last week revised that to 6.4. That's nearly $500 million a month being lost to black market tobacco. And I think we can all agree that big tobacco, legal big tobacco, are not lovely people, and that smoking is something we would like to see go the way of the dodo, and we'd like to see reduced smoking rates, ideally eventually to zero. But the pathway there can't be to empower people who are far less lovely than big tobacco, and that is Middle Eastern organised crime gangs and outlawed motorcycle gangs who are making mega profits through illicit tobacco as one of their business units. And that might sound like a strange way to talk about it, but rest assured, as opposed to the federal government and Mark Butler's policy, organised crime is incredibly efficient. And vapes and tobacco, vapes and cigarettes are cheaper, more readily available, and more easy to source than at any time in Australia's history. And, you know, it's at the point where when I speak to people about our policy of breaking organised crime's business model and tackling this black market, at least in large part through reduction in tobacco excise, it's an inevitable it may well be true, and I've heard Fiona say this on interviews of hers that I've heard, it may well be true that in other jurisdictions like New Zealand, there is a tax level that is kind of comparable to ours, along with harm reduction strategies like vaping, but we have gone well beyond that. We are in a place now where I personally believe that we could slash tobacco excise by 50%, and that would barely put a dent in the black market. The black market in tobacco has become so efficient and so adept at avoiding interdiction. These people are people who look at Mark Butler's, pronouncements and law enforcement efforts as profit opportunities, because they are. To point to the amount of black market tobacco and vaping products that are being interdicted at the border, to quote the immortal words of the Princess Bride, I don't think that means what you think it means. If we are seeing ever larger seizures at the border, you can guarantee that that means there are more than ever more and more shipments and more product coming through that's not being found. And if we think that there is not corruption in the AFP, in Border Force, and indeed in a state like Victoria and Victoria Police as a result of these prohibition policies, then we are poor students of history. So I wanted to make the point on the economics that in addition to, in tandem to the kinds of summits, the kinds of repeal of the ban, not only on vapes, but looking at products like snus and other things in Europe that have seen smoking rates far from plateauing, have seen some of the lowest smoking rates in the world. And if our government was serious about harm reduction and about lowering smoking rates, everything would be on the table. And why isn't it? The answer can't be found in evidence, contrary to Assistant Minister Kearney's comments. So that's enough about economics. I know you expect libertarians to talk about economics, although the last thing I would say before I move on from that is that the other role the federal government has to play in a national drug strategy that sees things like cannabis decriminalised is tax. And libertarians are not the people you would expect to be advocating for tax on products, right? I get that that's a weird position to have, but we would certainly rather a regulated, reasonably taxed market than a black market because of all the harms that are associated with that. And because of the constitutional setup of Australia, unlike in America, where the states can legalise and tax without reference to the federal government, and they can get great benefits from doing that, I'm convinced that the reason cannabis isn't legal recreationally in Victoria already is because there's no financial incentive for the Victorian government. So I think that federal decriminalisation needs to be coupled with a tax regime that sees the benefits of that legalised product flow back to the states financially. And let me tell you, there's nowhere you want to be less than being in between the federal government and a pot of money. So the final thing I wanted to touch on, and I suppose it's probably natural and inevitable given my bio that Laura read out, is that I think when I look through the current national drug strategy and the various reports that have been published reporting on its efficacy, the phrase that I have not seen mentioned once is lived experience. And I agree with Fiona that there should be a fourth pillar, that treatment and harm reduction should be separate. But I think through all of those pillars, lived experience is something that doesn't cost the government or the taxpayers extra money. Lived experience, though, when correctly managed and implemented, can make a profound difference to the outcomes of both people who are still struggling with addiction and other life-controlling challenges, but also the people who are actually participating as lived experience mentors and peer mentors within the system. I, 9 years ago, was sitting in a prison cell. In July, I'll be 10 years in recovery from drugs and alcohol, completely abstinent. And I think that without doubt, the thing that has enabled me to maintain that recovery and sobriety has been the opportunities I've had to use my experiences to help and support others. I first met Fiona as a co-contributor with VACRO at the criminal justice reform inquiry she held. And I don't think she probably quite expected us to be, I don't think she quite expected us to be here as candidates together running for the Senate. But I think those experiences and those opportunities to give back just benefit everyone, and a system that includes the lived experiences of people who have had those challenges and who have been able to overcome them would be one we would be far better for.
Thank you very much. Well said, everyone. I might invite everyone to come and take a seat up here now while we take questions. I think we'll first of all take a question from the floor. I think that's how it's going to work. And we'll pass a microphone around for that. So whoever's got a question who wants to be the lucky first, you want to introduce yourself first and go ahead. Stand up too, just to make it extra awkward.
Hi everyone, I'm Rob, I'm at the Alcohol and Drug Foundation. We mentioned a couple of elephants in the room, tobacco and others. There's one that kind of sits in terms of overall cost to the community. We think tobacco is about $130 billion. Drugs might be about 30 billion. Right in the middle of that is alcohol, about 70 to 80 billion. We haven't really heard about your thoughts on alcohol policy. So yeah, just keen to hear everybody's thoughts.
Yeah, thank you. Yeah, apart from calling for it to be banned on Tuesday, but it's interesting. I mean, our alcohol rates are declining in most demographics now. We are seeing a decline in it. I think we don't do enough education still. And I know the ADF has got some great programs and provides really good information on their websites. But yeah, when you look at the drug education that we get in our schools, very similar to our sex education. You probably get to learn to spell a few words, and you know someone dresses up as a giraffe, or I can't remember what animal they're dressing as these days, to tell you that drugs and alcohol are bad. But they don't necessarily say alcohol is bad. They'll tell you drugs are bad, but they don't necessarily talk to you about the incredible physiological impacts of alcohol. So I would like to see us start early in greater education around alcohol. I do believe its availability is pretty extraordinary, but I would also say that with tobacco, you know, whenever we... So you still want it to be sold absolutely everywhere, but you don't want people to buy it. Have you thought about age-restricted venues? And I think the same goes for alcohol. The absolute abundance and availability of it is incredible. It sends a message to our society that's very different to the message that we send on other drugs that we know are less harmful, like cannabis, for example.
Thank you. And yeah, thank you for raising that. Again, it's not just as someone who's experienced as who has abused alcohol themselves, but also as someone who's worked in the field. I've been a bartender, I've worked in a bottle, I even worked at a brewery for a little bit there. And it was interesting that by far the one with the healthiest approach to alcohol was the latter one, which I'm sure comes no surprise because it means a much greater understanding of it. I can helpfully report that alcohol education has gotten better. Certainly, my experience teaching it was a lot better than my experience learning it. And the bigger issue with the education is simply that that trying to get kids to think about the future in terms of long-term health effects is near impossible on account of their teenagers. But instead focusing on this is what happens to you right now in those situations, they quickly get grumpy because it means doing maths, working out blood alcohol content. They thought they didn't have to do maths that lesson. I think that the broader issue is around the cultural place that alcohol holds in Australia. We know that Australia is a place that has lower raw drinking rates but higher rates of binge drinking than most other countries around the world. And a lot of that is the way that alcohol is presented and normalised culturally in media. Sport is particularly a huge issue for this. Massive shouts out to Usman Khawaja for the work that he's done in normalising not booze at cricket, which is a completely radical concept. And this kind of just cultural expectation around it and socialization of it tends to create it. You know, you look at certain happy hours, particularly in the mid-20s, the era of the $15 pint, and it's almost as if certain bars want to bring back the 6 o'clock swill. Moving away from that, thinking about how accessibility is handled, thinking about how alcohol is advertised, when are responsible moments to advertise it, thinking about the way that it is presented to kids, right? I'm not saying that we've got to go out and put plain packaging on all of our tins, but thinking about the romance with which it is presented, particularly in Australian culture and media, is going to be a really key one for looking into the future and for continuing those, as you correctly pointed out, lowering rates of alcohol use amongst young people.
I'm very glad.
Yes.
I'm very glad that Tara didn't suggest plain packaging for alcohol, because I was a bit alarmed by that prospect. I think that would be definitely heading in the wrong direction. And I think we also need to be very aware of the impact that trying to control demand and tackling that demand reduction for alcohol through excise will invariably have, I suspect, I haven't had a lot of anecdotal evidence of this yet, but it would shock me if it weren't the case in the next year or two if alcohol excise continues to rise the way it is. We may well and truly be beyond the realm of April Fool's Day jokes in a couple of years with alcohol excise. There'll be microbreweries, stills. We will be well and truly in the Volstead Act if we keep going the way we are. And I think that we've seen people like James Martin and other great academics, even in The Guardian as recently as last week or two ago, talking about how we really have to rethink our traditional thinking on demand reduction and tax versus behaviour. I also agree with what Tara said about the cultural dimensions really being the biggest issue. And I think, it might not be a name that everyone here wants to hear, but JD Vance, when he went on the Joe Rogan podcast, made the comment that government is uniquely bad at solving cultural problems from top-down interventions. So you may not like anything else he says, but I really liked that comment. And I think a big part of it is us as political leaders or aspiring political leaders and the role models that young people see on TV and politics or anything else, setting that example and really kind of demonstrating leadership on that issue.
I might go to an online question now, I think. Caitlin?
Thank you. I'll read it in my best Siri. This one? Just bear with me. So a online person would like to know what the government is doing or is going to do in addressing housing issues, given most of our clients talk about the stresses about housing being the biggest driving factor to their drug use.
All right, I'll start because I think what I have to say may not necessarily be what most people would think of, and that is that we need to get government funding and stimulus out of the housing market. We are in a Ponzi bubble that is just expanding and expanding and expanding. And I read a statistic the other day that I actually thought was incorrect. I thought there must have been a number wrong, and that was that 1% of people on Centrelink can afford an entry-level rental. And I don't think that's a comment necessarily on the level of Centrelink, although that's a separate conversation. I think that's a comment on the dire state of both supply and demand in housing in our economy. And if you think about the second and third order implications of the government's Help to Buy scheme, where the government will own 30 to 40% equity in your home, you'll own 5% in your home, and the bank will own the other, 55%. It's insanity. And you're literally putting the government in a position where it has no incentive to lower the cost of housing for everyday Australians. So I view that with deep concern, and I understand that the easiest thing, we talked about hammers and nails before this started, and I think to a government doing something to fix the problem and saying, oh, we're going to either buy existing homes or build new homes or make it easier for people to buy homes, this is all just pushing, as my bio said, kicking the hard decisions down the road and delaying the inevitable crash or bursting of the bubble that must come. Yeah, I think the best thing the government can do with respect to housing at a federal level is get out of the way.
I'm sure you'll be shocked to hear that my opinions slightly differ. I rent. I, like more than 40% and rising of the people in my electorate, rent. Like most, professionals approaching middle age. Most of my friends in our 30s and 40s. Very few of us have bought our own homes, and most of the ones who have, it's taken a family member's death to be able to do it. Thank you. Right. The point at which I would disagree is I do completely agree that I think that a lot of what the government is doing is making the problem worse, not better. But I don't think that that's for reasons of a raw binary of government intervention versus government non-intervention. We see the government intervening on the side of investors and developers because it's a government that both major parties do take those donations from developers and investors, and the government is made up of landlords. The average amount of properties held by a member of the member of parliament is 3.4. There are only of the 227 MPs in parliament, only 3 rent. That's not representative of the total population, where for the first a couple of years ago, for the first time in recorded history in Australia, more people are renting than own their homes outright. Right here in Victoria, the state government is selling off a bunch of public housing to private developers. Not only is that going to make a bunch of people homeless, but what it's going to do is it's going to have a negative effect driving up housing prices. The problem isn't a strict one of supply and demand. The problem is in the supply of available and affordable housing. If we build another luxury unit where it's very possible to just leave 9 out of 10 empty to drive up demand and then rent out the other one, an investor, particularly with the amount of tax breaks given to them by the government, is actually making more money from that than if they were to put out 10 reasonably priced units. Having a greater investment in public housing not only has a good impact for the people who need it and rely on it, as someone who was on Seno when she was at university, that is the opposite of a surprise. It was difficult enough back then, and the property market has gotten a lot worse in the subsequent decade and a half. It's going to have a knock-on effect of increasing the amount of affordable housing that is available to people. Having the government step into the role of providing housing for those who need it, a role that the government once did very, very well, even in times that those on the right side of the political spectrum, the Liberals point to as a golden era, as an era where we had more than 10 times as much public housing as we do now because of the government continuing to sell it off. This is an issue very close to my heart, and I'm glad that that our friendly online questioner reconnected the issue of material conditions and material uncertainty, thanks to our thoroughly broken housing market, back to the issue of drug and alcohol abuse, much of which stems from that kind of material insecurity.
Housing First is constantly talked about, but we very rarely enact it, and that is how we have to flip this. When someone, we know the cases, and I'm sure many of you have had clients in the room where they're trying to get into a house, but because of their drug use, they are rejected from getting into a home, and that can be public housing as well. So the Housing First approach must be the approach and the strategy that we take. And if governments look after those most needy and most desperate for housing, and particularly people experiencing homelessness, then the rest will rise, and we will see that housing at that mid-level becomes more affordable if the government can look after the housing at the bottom. Now, I chaired the inquiry into homelessness, and yes, we do know people who can't get into a house because of their drug use, but we also know the debilitating effect of not having a house and not having a home can have on people's mental health, but also their drug use, and it then becomes this incredibly vicious circle. We put people coming out of prison into homelessness. We put people coming out of hospital into homelessness. This makes no sense in any level, from a compassionate level, but even from an economic level. So I would say that we need to start building, but we need to be building to meet the needs of those who can least afford housing at the moment, and let the rest look after itself. I was in Scotland where I saw Housing First models which work. I'm on the board of VAADA, which, as most of you know, is a prison reintegration program organisation, and we're just doing a Housing First program there. It's funded by Treasury because Treasury understands that we can stop recidivism if we can provide housing. And we can help mental health, we can help drug use if we could provide housing. I suspect there's a lot of people looking at you, Stefan, at Odyssey House, who may not have ever found their way to Odyssey House if someone had been able to provide them with a home before that, where you can wrap services around. So that is where I think we should be focusing on and then let alone the million homes that are empty in any one night, and our vacancy tax that we have in Victoria, which is largely voluntary. It's a tax where you put your hand up to say, actually, I think I owe you some money. I've got a vacant house. As you can imagine, that's not working very well.
We'll move to another question on the floor, and we might try and keep our answers now just to a minute, because we are running a little bit over time. So try and get to a few more questions before we wrap it up. Can you just introduce yourself? Stand up, please. Go on.
It's like school.
Hi, my name's Ama, and I'm from the Association of Participating Service Users at SHARC, which is the Self-Help Addiction Resource Centre. A couple of things. First of all, to Jordan, thank you for bringing up lived and living experience and how important that is in this sector. One thing I would suggest is that it doesn't come cheaply. There needs to be an investment in ensuring people able to have a voice and have opportunities to build that voice and to advocate change and to build those movements. I also think there needs to be a bigger investment in the workforce and making sure the workforce is safe, and that people accessing services wherever the things are coming across an AOD lived experience worker. So that'd be one of my two things. I'd be really interested from the panel around how we think the national strategy should be leaning into lived and living experience. The other thing that has come up a lot in the consultations we do with our members is around the need for supports in the community after treatment, and that's something that I haven't heard today, so I'd really be interested in hearing your views on that. And then also something else that hasn't come up today is that how difficult it is to navigate the system, and to also to be able to get into a service when you need it and when you're asking. And so we advocate on behalf of service users, so I'm really interested in that kind of perspective.
It would be lovely if there was no wrong door. If there would be absolutely lovely, and I think that is a goal for many of us in this room, that people should be able to walk through a door to get help and get the help that they need, and not be turned away because, I'm sorry, you may have a drug, you may hear about your drug use, but you've got a mental health issue, so we can't see you, or vice versa. Just going back on that lived experience, though, and knowing that I'm going to keep this to a minute, stigma. For people with lived experience, I had to think long and hard before I came out talking about my own, probably relatively non-problematic drug use. But for people, and I'm sure for Jordan, this was not something that came easily to be talking about your drugs use. So for supporting people with lived experience, we need to do this by reducing the stigma around this, and probably means that more of us have to talk about our drug use, and so that we see a spectrum of lived experience around drug use. But certainly I know most of the organisations here would have lived experience as a it would be an important part of your strategies and of your organisations. So I think we're there, but recognising it more fulsomely. We saw it in the Mental Health Royal Commission, but we didn't quite get there, and we need to do more.
Yeah, thank you so much. So in addition to what you've mentioned about stigma, incredibly important point, and thank you so much. I think that a lot of the difficulty in navigating comes from the fragmentation both of the different actors within the sector and of government planning, both at a state level where things are often done far too short term, and at a federal level where you have 9 competing systems often acting in opposition to each other. It becomes very, very hard for someone, even when those systems are acting in concert, and they suddenly have to find that there are, one organisation and another centre may not even be aware of each other's existence. We need to have a greater sense of centralised planning and strategy, not just for the sake of having a long-term vision on this, but for the sake of navigating those systems approachable to those who need it. I think that Fiona's earlier calls for summits, not just studies but summits, I think are crucial. I think that anything that as much as I value every expert in this room, I think that if all we listen to are the experts without the lived experience and only prioritise that over the people who do have lived experience, then we are seeing less than half of the picture. I think that that becomes really crucial. And having those different types of lived experience, those of us who have been, as Jordan has, on, you know, as you mentioned, all three pillars, people who have been involved in the very, very pits of it, people who've only involved themselves in drug use in a more casual and lighthearted way. That's still an element, and a major element, I would say, of drug use in this country, and needs to be taken into account in order to have a holistic view of it.
Yeah, I'll be very quick. Yeah, I know. Yeah, I can see my peripheral vision. I can see the lunge coming. No, of course. But look, it was my experience, and I'm a pretty determined, motivated person, and I came out of prison like a rocket. Like I was, you know, I had 27 months to think and plan, and, you know, I was super motivated, you know, had all my ideas and my goals in my head. You know, navigating intensive parole and trying to manage 5 different appointments a week with 5 different services, none of whom really knew what each other was doing. Like, it was challenging. It was bloody hard. And like, there was no way work could come into that first 3 months, like zero prospect. Intensive parole was a full-time job. Yeah. So that's the first anecdote I'll share. The second, in answer to your question about lived experience within the National Drug Strategy and within the kind of services you guys are providing, I'm not going to name the organisation because I don't know if they're here or not today, and I probably wouldn't anyway. But I think lived experience can't just be tokenised. It can't just be for the ground level support workers, and, you know, it can't be that you're just the lived experience person who's there to fill in the numbers and to sort of be that token representation at a grassroots worker level. I think that lived experience needs to be integrated into the middle and higher tiers of management, and that's where I think that investment needs to come, because you can hire for experience and attitude and train for skill, but you can't do it the other way around. You can't train someone to have the experience that I've had. But I had an organisation actually approach me after a reintegration puzzle presentation I did, saying, "Oh, we've got this opportunity as lived experience manager, whatever, you should apply." So that's what they said to me. I applied, and I was told, unfortunately, I wasn't successful because I didn't have the requisite experience. So, you know, I think that's a good note to end on. So.
Thank you. We've got a question online I think we'll go to now.
So this is a question from Simon Crows. He says, with declining pharmacotherapy prescribing, what will be done to increase the numbers of prescribers? So could it be made a mandatory / strongly encouraged part of GP and psychiatric training? Could there be a greater role for nurse practitioners?
Yes. Definitely nurse practitioners, and yes, we have our GPs, our pharmacotherapy GPs, and pharmacists are aging out. And so this is actually a yesterday problem. This is absolutely urgent. So I definitely think reducing the bar so that we could see nurse practitioners doing this. I also think different types of pharmacotherapy. So I would like to see hydromorphone be more readily available. I mean, personally, I'd like to see a heroin trial, but you know, probably. That ship probably has sailed. But this is an absolutely urgent issue in Australia, and it needs to happen at a federal level. Now, I think we can also, I mean, Victoria is the only state where we don't actually incentivise prescribing or dispensing, and I think we should need to look at that. But I do think that this is something that could happen at a federal level, and we could do something through the PBS, and we could do something through Medicare.
Yeah, that is a really fantastic question, because it ties so neatly into the last one, talking about accessibility, talking about people actually, you know, it's all very well and good to have these services on the books, but if people aren't able to get to these services, then what good is it? And we're here in Melbourne. We're here in the second biggest metropolitan area in Australia, with I would say, the least worst public transport system going. Think about people in regional areas and how much more difficult it is in regional areas to have access to any sort of this. I think that it doesn't just come down to having, I'm fully in support of nurse practitioners, but it does just come down to having a broader pool of people able to. It comes down to actually properly funding and making available those things. Sometimes the private sector doesn't see the profit in having this kind of thing. That is where we need to have, more of these, more clinics, more dispensations, more places where people, especially in areas that are a bit of a desert, can have access to important life-saving resources.
I'm going to say something that might be a little bit outside the envelope and quite far ahead of where the debate currently is. But I think that much like with vapes, where I believe the solution is a consumer consent-based market for adults that is regulated, I actually believe pharmacotherapy could have that similar kind of solution, because at the end of the day, just like we see vapes being prescribed through chemists and pharmacists not working, nobody's buying them there, nobody's stocking them there, they're not interested. And so many GPs view the clientele who come with that pharmacotherapy market as something to be avoided like the plague. And we saw in recent years that the Frankston clinic that did this, the main gentleman who prescribes went on holiday for about 4 months and it all shut down. And the government wasn't prepared for it, because it was just based on the generosity and experience of this one gentleman. And it shouldn't be like that. So I think that actually thinking outside the square and actually exploring some consumer market options for pharmacotherapy, I think that could be a great solution.
We are a little, probably 10 minutes over time. Do we have another question on the floor before we wrap up? I'll get to you.
You can ask now.
You can all stay longer.
Hi, my name's James Dunn. I'm from the Australian Alcohol and Other Drugs Council. So we're the national version of VAADA and represent the AOD sector to the Commonwealth Government. And I think part of our role is really, that the Commonwealth Government, it obviously sets the sort of legal environment, but they are a really increasing direct funder of AOD services. So my question, and forgive me for a little bit of a preamble, but we know modelling suggests about 500,000 Australians can't get access to treatment each year, and that figure's been pretty consistent over about 15 years. And with the funding at the Commonwealth level, we're seeing things like short-term contracts, late contract renewals, inconsistent or completely absent indexation being applied to funding contracts, and overall just a really, the quantum of funding doesn't really match the demand that's out there. And a good proportion of our workers across Australia expect to lose their positions in the next 12 months just because there isn't the funding that's available for that. So, our sector is really built on the back of the dedication and the expertise of our workforce, but the goodwill doesn't keep the lights on. So I'm curious about your thoughts on this and how you might seek to address that if you're elected to Parliament.
Really easy, and I'll be super quick. Won't even be a minute. I would propose at least halving the budget that is dedicated to enforcement and interdiction, and just putting that over to harm reduction. Easy, simple. Libertarians aren't big fans of increasing government spending, but this is a situation where it's not a question of how big the envelope is. It's a question of how the envelope's getting applied. So I think that we don't even have to talk about reduction or slashing or anything like that to fund harm reduction services properly. We just need to start focusing on what we know works.
Yep. Absolutely. Security of funding means security of workforce, and security of workforce means security of outcomes for our most vulnerable people. We have, as I mentioned earlier, governments that take far too short-term a vision, and mostly when they try and say that they're doing a long-term plan, they make sure they have the funding for that backloaded, so that when they lose government, they can just blame the other guys for it not being funded instead of them being in for 2 terms and not doing anything about it. Again, education experience coming through here. I would 100% agree. Taking that money out of the failed enforcement model and putting it into a user first needs based harm reduction model is 100% the move here.
Yeah, without doubt, we have to refocus our funding. But I would also add that this is across all sectors, community sectors, is short-term funding and short-term contracts. And it is absolutely impossible. And I know your sister organisation, ACOS, and our state organisation, VCOS, we have all joined in the campaigns for longer-term contracts, and we have to maintain that fight. I mean, for a start, it's expensive for governments to be reviewing and renewing contracts every fucking 12 months. But for everyone who works in the sector, you know, not being able to know whether you can, you know, buy a car or you just don't know, it's it's outrageous. It makes no sense, and we have to keep up that campaign. And you know, if I'm successful, please be the first to knock on my door to shout loudly about this, because both federal and state, and federal can start pushing those levers on longer term contracts for programs. And yes, this really makes my blood boil.
Before you stand up, we've just got one more question down the front, and I might get in trouble if I don't pass him. I'm just going to use this mic here. It's been eyeing me.
Hi everyone, I'm Ruben, and I'm looking after a service called Reconnection, and it's a part of the EACH organisation. Speaking of contracts, we're about to close the doors in June 2025. And I've heard we've talked about a little bit about alcohol today. We've talked about opiates. We've talked about opiate replacement therapy, but we haven't spoken about benzodiazepines, and it's one of the leading contributing factors to fatal overdoses. There were 4.5 million scripts written, benzodiazepine scripts written in 23-24 financial year, PBS data. And we've been going for 40 years. We're about to close the door. So there's obviously a bit of self-advocacy in here. However, it's, you know, this service has been in operation for a long time. The problem's getting worse and worse. James Martin presented at the VAADA conference and talked about the black market and the influx of novel benzodiazepines. So the issue is just going to get worse. So yeah, just running on your policy position on benzodiazepines and overdose.
Thank you for that. No worries. I'm a rule breaker.
You can hold it. Yeah, good. I like this. She's just keeping.
I'm going to hold it for you.
Yeah. Well, that's what I thought you were doing. That's what I thought you were doing. I'm lucky I didn't give.
Why didn't you tell me before we started?
Give her this idea earlier.
You're
Look,
off.
fortunately, for me, the issue of benzos wasn't something I struggled with personally, but I did see people go through that, and it was probably worse than almost any illicit recreational or otherwise drug I've taken or seen the impacts of. Like, people just turned into zombies, and like you say, the consequences of detox and getting off benzos and alcohol, probably the two most horrific things that, like, out far and above. So I do absolutely think that as part of that kind of reallocation of funding, something like that, and it's not just about funding services, because obviously you're just trying to tape the damn wall with fingers and thumbs. It's really about education, and also making sure that GPs aren't recklessly writing scripts, because it is shocking.
That's part.
Yeah, absolutely.
Yeah.
Yeah.
Yeah. I do yeah.
I don't want to reach across you, that's all.
I do apologise. I haven't looked specifically at benzodiazepine policy in preparation for this. So I'm simply going to go back to our first principles of evidence-based harm reduction and making sure that we have proper long-term vision on funding for organisations like yours. That's such a disappointment to hear, because I do know that this is an increasing issue, and it's evidence of short-term thinking at the governmental level, that in an era when things getting worse, they're deciding to cut away funding to the people doing the most about it. So sorry. I'm really upset that funding's not being renewed, and I'd be happy to speak about if there's any advocacy I can do. The one point I just wanted to make, and just so I stay on brand, because that's what I'm supposed to be doing running for an election, medicinal cannabis. So we know that a lot of, particularly our veterans who have been prescribed, you know, insane amounts of benzodiazepines, that actually medicinal cannabis has proven to be an excellent replacement therapy for them. But they can't drive if they're on medicinal cannabis. They can if they're on benzodiazepines. You know,
So certainly, I think, and I was recently at a medicinal cannabis conference where we actually the role of medicinal cannabis as a treatment. For other drug use is proving to be really successful. We've seen opioid rates decline in states in the United States where cannabis has been available, and I was looking at the evidence around this on benzodiazepines as well, that medicinal cannabis can prove to be an excellent alternative and an excellent alternative therapy for people wanting to stop using, but also for people who are using them, that it can provide some treatments without the significant side effects of benzos.
Thank you. And a round of applause for our candidates here today. Thank you, everyone.